We'll get started in a minute or so, but while we're waiting, feel free to just introduce yourself in the chat, tell us where you're from, and let us know where you're joining us from, and also the language most requested in your program. If you want to do that while we're waiting for folks to join, that would be great. All righty. We have a couple of folks on the line, so let's just get started. My name is Tatiana Torres. I am a training specialist here for Freedom Network USA. We are so excited for you to join us today in our language access and housing webinar. And as we're just kind of introducing, feel free to drop your name and your location and the language most requested in your program in the chat. But we are just going through to run through some logistics for today. So can I go to the next slide, please? Great, thank you. So just, some logistics for today's presentation. We have a couple of interaction tools. We will be utilizing the chat box as a way to interact. So if you're comfortable, feel free to mark all attendees and panelists so that everybody can see your responses and that we were able to collaborate with one another. And we will also be having a question period at the end, so feel free to utilize the Q&A box to ask any questions that you'd like the panel to address. And finally, we do have closed captioning available for this presentation, and you can enable that by clicking the green CC button on your screen. Next slide. Thank you. So today's presentation is put on by the Freedom Network's Housing Training and Technical Assistance Project, funded by the Office of Victims for Crimes. We provide support to service providers such as yourselves on understanding connecting housing options for survivors of human trafficking. We host bi-monthly webinars on the intersection of housing and human trafficking. And we have a resource library available that has fact sheets, webinars that is constantly updated, and we're always, trying to hear what folks are saying and provide support. So all of that is always found in the resource library. And then we also can provide one-on-one support to OVC grantees and their partners. So just for a quick again, just housekeeping, we are recording this webinar and it will be sent out to you within 2 weeks of the presentation today. Next slide. All right. So without further ado, I will introduce your panelists for today. First, we have Takina Chattery, who is the Associate Director of Helpline and Residential Programs at Womankind. She oversees Womankind's 2 emergency residential sites for survivors of gender-based violence, as well as their 24/7 hotline, which offers text and chat services. Womankind utilizes a language access program across all of their services to ensure that survivors can receive appropriate support. And next we have Amy Fleischauer, who is the Director of Survivor Support Services at the International Institute of Buffalo. During her time there, she has grown the Institute's program by initiating a specialized housing program, language access, educational programming, and intensive focus on minor victims of labor trafficking and advocating for criminalized survivors within the local human trafficking intervention court, and targeting the intersection of opioid use and human trafficking. So with that, I will pass it over to our presenters today.
Hi, everyone. I am so excited to be presenting today. We at Freedom Network and certainly at the Institute believe that there's a ton of knowledge in the room. So while in our virtual room, I guess for today, so while Takina and I are the presenters, we are certainly not the only experts. And we believe that the more participation that we have, the more that we will all learn. So we are eager for your participation, sharing your experiences, some best practices that have worked for you. There'll be many opportunities for those throughout our time together today. We've asked you to share the languages that are most requested. And I think not surprisingly, I see Spanish as the #1, although there have been some diversity of answers here, which is fantastic. Takina, do you want to share about the top languages requested at Womenkind?
Yeah, absolutely. Hi, everyone. It's lovely to be in this online space with you all. For us, I would say the languages most often requested are Mandarin and Bengali. And I think that's also because of who is in our network, how are we known, and what are the services that we're known to provide in the languages that we do. And so I think, based on word of mouth, based on the community we work with, we'll get more of the languages that we do serve people in.
Thank you. For us at the International Institute, Spanish is also our most requested language. The next 4, though, are again pretty across the board. Arabic, Bengali, Burmese, and Swahili are the next top 4, I guess, languages. And we wanted to bring this up as Takina and I have prepared for this webinar. We were pleasantly surprised to see how our both our philosophical approach to language access and the best practices that we utilize every day are really similar. And even though we are at opposite ends of New York State and are not necessarily dealing with the same populations that speak the same languages, that human right, language access as a human right, is at the center of everything that we do around, I hope, all of our services, but certainly language access, which also is a main reason why Womenkind and the International Institute of Buffalo are members of Freedom Network. That is a common core, is talking about the services or the types of things, having a human rights-based approach. So with that in mind, the learning objectives that we're hoping to address today is to allow all in attendance to understand the role and qualifications of professional interpreters, as well as dual role staff, to review and discuss the common challenges, as well as some problem-solving scenarios involving working effectively with interpreters. I've been working with interpreters now for almost 17 years, and it is a skill, to be sure, and one that, like any skill, I have to keep practicing. So we'll talk about some of the hiccups that certainly I've experienced, and that maybe some common hiccups in that building that skill of working effectively with interpreters. We're also going to provide some suggestions on implementing a successful language access plan and programming within housing facilities. And part of what we're going to be talking about is, what does a language access plan even involve? That might be a new term for some people on the call, or it might be something that some people think is only focused on the interpretation or providing interpretation, when a full successful language access plan is a lot larger in scope. And then finally, we will review the elements of that comprehensive plan, including the practice of cultural humility. Language access is not only about the language itself, but again, is broader in nature to help support anyone who is coming through your doors and feeling safe, and that they can communicate and express themselves in a way that feels safe to them. Next slide. Takina, you want to take over from here?
Thank you. So I'm going to go ahead and talk us through some definitions, as well as some policies that have come through over the years that are relevant to language access. So to start off, what is limited English proficiency? So limited English proficiency is defined as speaking English, quote unquote, less than very well, as self-reported by people in the US Census. So people with limited English proficiency might not speak English. They might have a limited ability to understand, to read, write, speak, or understand English. And it's also context specific. So an individual might be conversational in English, but they might not be fully fluent enough to communicate and participate in medical or legal proceedings. It's also best to inquire with somebody about what their primary or preferred language is. Oftentimes, someone may be able to speak English with someone else, like I was saying, conversationally, but their capacity perhaps to understand the context of what is being expressed may not necessarily match with what we're seeing from them. So it's best to just ask. Next slide, please. So some language access laws that are relevant. So federal, state, and case language access laws set standards for how to overcome the language barrier for LEP individuals. The Civil Rights Act and Title VI in specific prohibits discrimination on the basis of race, color, or national origin in programs and activities that receive federal financial assistance. And Executive Order 13166 of 2000, which was signed by President Clinton, also requires that federal agencies examine the services they provide and identify any need for services to those with limited English proficiency. So essentially, it requires federal agencies to examine the services that they provide and develop and implement a system to provide those services such that people with limited English proficiency can also have meaningful access to them. And it requires federal agencies to issue guidance on language access for the recipients of federal funds. Next slide, please. The Department of Justice also has provided guidance saying that any recipient of federal financial assistance has a responsibility to take reasonable steps to ensure meaningful access and understanding. And the Department of Justice strongly suggests that a written language access plan be put into place. The Department of Justice also discourages use of informal interpreters except in limited or emergency situations. And the Department of Justice generally advises that if 5% or 1,000 people in a population, whichever is less, has limited English proficiency, then vital documents need to be translated into that language. So it's up to an agency to determine what documents are or aren't vital. In terms of emergency situations that I mentioned previously, so some examples, I can pull an example that you might see at one of our residential facilities. So we usually would not use an informal translator like someone's child unless it's a medical emergency, for example. If it's a regularly scheduled session that the client has, we would arrange for appropriate translation or interpretation services to be in place for that session. But like I'm saying, if it's someone's experiencing a medical emergency, for example, and they're living at our site, if we're not able to get a translator on site immediately, then we would use a family member, whereas we might not usually do that. Next slide, please. And so some of our kind of most important takeaways from this information is that individuals who have limited English proficiency do have a right to services in their primary or preferred language at no additional cost to them, including housing services and facilities. And meaningful access requires a qualified interpreter and translator. And the more essential the service, the more important it is to use a qualified interpreter, particularly within housing and shelter facilities. And language access practices can impact admissibility of evidence and court decisions. So some of the ways that we've seen at Womankind, some of these takeaways play out is we had a client, for example, who prior to working with our agency was telling us about the hardship that she was having with a court custody battle that she was having with her ex-partner. And because she had limited English proficiency, and because the court also wasn't necessarily providing her with meaningful access to an interpreter, the client wasn't able to properly express what was going on in that situation, and as such was the client felt like she was being wrongfully tried against in her custody case. And so we can see many, many ways in which language access can impact a person's life and impact the decisions that are made around their situations. And next slide, please. So there are also some differences between translation and interpretation, even though it might seem like the same thing. So interpretation is the process of orally rendering spoken communication from one language into another language, whereas translation involves converting written text from one language into written text in another. Next slide, please. And there are different types of interpretation as well. Simultaneous being interpreting while the delegate is speaking. We can see some of that with headsets and things like that in conferences. Consecutive interpretation is interpreting after the speaker is finished speaking. And sight translation is reading a text by the interpreter from the source language into a target language. In terms of interpreting after a speaker is finished, at our agency, there's also certain ways in which we do that, where maybe someone is speaking and has a narrative that they're sharing, but they might stop every couple of sentences to allow an interpreter to come in and speak, so that their interpreter isn't then tasked with, at the end of a dialogue, kind of interpreting a lot at once. Next slide, please. The American Disabilities Act of 1990 is a civil rights law that prohibits discrimination based on disability. And according to the ADA, this covers covered entities would need to provide aids and services when needed to communicate effectively with people who have communication disabilities. And the ADA places responsibility for providing effective communication, including the use of interpreters, directly on covered entities. Though separate from language access laws, the ADA's requirements can help create a meaningful language access plan. And so some of what is in language access laws are also, you'll see some overlap in the Americans with Disabilities Act. And so essentially some of this can work in tandem and can be considered together when an agency is developing their language access plan. Next slide, please. And so ASL, American Sign Language, is the primary sign language used by deaf and hearing impaired people in the United States and Canada. And so I don't know if some of you all are also contracted through the city with Human Resources Administration, for example, like we are. They are also tasked with providing agencies that are contracted with them with meaningful access to sign language interpreters. So there are also, and I say this to say that there are resources out there for smaller organizations as well to pair with already existing services, so that we're not, kind of reinventing the wheel.
And while this may be, if we could just go back one slide, intuitive once I say it, it had never occurred to me until we started working with our first foreign-born survivor who was also deaf, that sign language looks different in different countries. And so that it's important to be thinking about resources that you may be able to utilize or organizations you may be able to reach out to when you are working, for example, with somebody from, we recently had somebody who was from South America and deaf and used sign language. And so that's not an easy access to provide, but it is something, again, the efforts that our organization put into utilizing someone who was able to sign in that way built trust immediately with the client, and we were able to work effectively with them. I think that's, before we kind of go on, I just want to say that all of these things that Takinia reviewed are so important for our own knowledge base and kind of checking ourselves and our own organizations. Are we following these laws? But again, the larger picture is not just about mandate or legislation, it's about that human rights-based approach. So what are our policies and procedures and practices that espouse creating a safe place so that survivors can feel the safety that maybe was not afforded to them, certainly was not afforded to them during their exploitation, and being able to provide that access and provide that safety, or even the beginnings of that safety, will allow for that rapport and trust to begin to build so that those services will be effective. I always talk about how with trauma-informed care and human rights-based approach, that's never on any report that I send in. I don't record, my staff doesn't record how many times a day that we're providing trauma-informed care. There's no, it's not in our grant reports, and yet without it, we can't possibly effectively provide any other type of service.
I'd also like to comment, thank you so much for the correction in the comments. So essentially a correction is that we would not be using the term hearing impaired, and we would be using deaf or hard of hearing. And so thank you so much for that correction.
So we're going to ask for a little bit more participation here. Our first poll, can we launch that, please? So we're just, we wanted to get a sense of your utilization of language access plan. So is your organization, not just you as an individual case manager or supervisor, but your organization as a whole, are you utilizing a language access plan? We'll just give a couple more seconds for folks to complete the poll. All right, and how did we come out here? Okay, so about 75% of you are, that's fantastic. And again, points to how there is absolutely more expertise in the room beyond the presenter. So we hope again that you'll chime in. We could go to the next slide. So when we're thinking about elements of a language access plan, again, I think there's often the misunderstanding that language access only means that I'm providing an interpreter. Language access plan is really a lot more holistic than that. It really starts with thinking about and then writing down and implementing a policy statement, something along the lines of, our goal is to provide equal access to services. This might be part of your equal opportunity statement, and that's made public. So that this policy statement has investment by your leadership, that it's something that's reviewed during new staff orientation, and that perhaps even more importantly, that you're thinking about ways to make sure that the public, your constituents, whether those be clients or consumers, that they understand this to be true as well. So how, when you're thinking about this policy statement, to be thinking about how do our potential clients understand this to be true? And where can we place this statement along with maybe our mission or vision or a commitment to trauma-informed care? All of those statements really are things that you want to be sharing with your stakeholders, most notably those that you want to attract to your services. Also thinking about your definition of terms. So again, thinking about your language. It's not something that things will roll off your tongue overnight, just as you saw us misuse some language earlier in the presentation, but to be thinking about the difference in when you're talking about translation versus interpretation. There was a question I saw in the Q&A around limited English proficiency and maybe rephrasing that. I've heard that term utilized, I think, a little bit more sensitively. New English learners might be something that that is more appropriate, or new English speakers, something like that. Thinking about your description of services and how you're going to assess for language access. So one of the things that is really important to understand is that people can talk about difficult experiences best often in their native language. So for those whose language first language isn't English, at the Institute, one of our policies and practices is that we will always have an interpreter present in the individual's native language when they are sharing an experience or being interviewed that involves them speaking about their trauma. And so if they're, for instance, putting together a statement for their visa petition with their immigration attorney, or if they're preparing for court, anything that causes re-traumatization or triggers a client, we always have, or at least offer, and sometimes even for that first meeting, well, as a matter of policy, just have an interpreter there in their native language so that the additional work of interpreting in their mind is a lower barrier, right? So if somebody's talking about their experience of trauma and then also having to do the work of interpreting inside their head, that can just be more exhausting. And so we want to at least have that option available. And I will say that more often than not, survivors will tell us that they don't need that and are also happy when it is provided. Again, we usually, if somebody insists on not having interpret, I've been in this country 20 years, my English is proficient, that may be true. And then we're just direct with them about some of the experiences that other survivors have had, again, in talking about trauma and having that, extra support when that's happening. We're going to talk a little bit more about procedures and appropriate scenarios later today. We discussed briefly how we as agencies and how you as an agency can notify the public about your language services. And again, I'll be interested in individuals in your organizational tools. But at the International Institute of Buffalo, we have a lot of signage. So we have in our top 10 languages, we make sure to have signage around our building and on our front door, on our website. And then we also have an I Speak card at reception that has the phrase I speak and that particular language in 40 different languages, so that when clients walk in, they may not, they can just point to that language, and then reception can ensure that an interpreter, either in person, somebody we have that's bilingual in the building, or a language line can be utilized to understand what they need. We also make sure that clients have I Speak cards so that they can fill in for them we can help them fill in English. I speak, for example, Arabic, so that when they are accessing other systems without accompaniment by our advocates, that they can independently advocate for themselves to ensure that language access is utilized within that system. So for example, when they will utilize that card when they're attending a Department of Social Services appointment, maybe their first meeting with their family legal attorney, or even shelter, as most pertinent today. Training. So we have very regular training with our staff, not only on how to work effectively when using an interpreter, but effective tools and skills in whatever way that interpreter and access is being utilized. So we have telephonic interpreting, we have web-based interpreting, where we have interpreters who will come up on our computer screens or our tablets. We have in-person interpreting, and there are different skills when working with each type of language access. So we make sure that as part of our orientation and then ongoing training, we're talking about those skills of access in the different realms, and that we're also talking about cultural responsiveness. I know that this may seem like a lot of training, right? I don't know about everyone on the call, but our orientation is already 2 weeks long. So that's why ongoing, I think training is important, and really thinking about what's most prudent. Last year at the International Institute's Trafficking and Domestic Violence Services program, we served survivors from over 50 different countries of origin who spoke 62 different languages. So it is absolutely impossible for every one of our staff members to be perfectly culturally competent or responsive to each one of those languages and cultures. But there are basic skills that we can train in to make sure that we are being as trauma-informed and responsive as we can. We also want to be thinking about our reporting requirements when it comes to how we are ensuring language access and addressing emergencies. So like Takina said at the beginning, there may be times where non-professional interpreters need to be utilized, or something like Google Translate needs to be utilized, and having a plan around that, I think, is important. Next slide, please. I have another poll here. So we're going to talk a little bit more about relying on different types of interpretation. So just wondering, and again, so this says choose all that apply and single choice. So I'm hoping that we can choose all that apply. What types of interpreting does your organization rely on? Choices: bilingual staff, telephonic interpretation, Google Translate, video, or in-person professional interpreters. Just give folks a minute. All right, it looks like we can only choose one. So maybe you could choose the one that you most often rely on. Thanks, Meg. All right, and do we have the results there? Okay, so it looks like our top two, and they're pretty close here, are telephonic interpretation and bilingual staff. That's great. I have to also say that I am thrilled that Google Translate is not at the top. We have a lot of very funny stories about Google Translate and what clients did not say, but what we or other providers thought they said when utilizing Google Translate. So again, that might be required in an emergency situation, but we would suggest that that is not best practice because, well, you can imagine why, but the mistakes abound. We'll go to our next slide, please. So we talked about a broader language access policy and what that would involve. When we think about language assistance procedures, one of the way that to think this through is to first identify the need. So how does that person need to communicate? What is the way that they can communicate best? Then to identify the language. And I think also with the need, it's what type of communication or what is the content of the communication that's going to be utilized. So for example, most of our clients have very basic, at least very basic English proficiency, even though they're new English learners. And so we're able to communicate effectively when it comes to we will meet tomorrow, for example, or come to the institute or call me tomorrow, those types of things. But certainly if we are going to have a longer conversation, if we're going to be asking them to sign anything, especially around consent, confidentiality, roles and responsibilities, their rights as crime victims, any of these things we would absolutely affect what type of access that we would utilize. And then providing that language services via staff that speak that language or professional interpretation services. And again, we'll talk a little bit more about which is appropriate, but in general, bilingual staff is a fantastic thing. And it works very well for basic case management. However, we would never want to assume that even someone on staff would have the language to be able to, for instance, talk through and understand the full experience of someone's trafficking exploitation, or have the specific words to interpret around medical needs or court needs, those types of things. So in those more complicated and nuanced situations, you absolutely want to employ professional interpretation services. Taking before I move on, do you have anything to add here? I saw you nod.
Yeah, I wanted to say how much I agree with this point about not necessarily assuming as well that a staff member will have the fluency required. And I think even in terms of like, what is fluency in language, right? So I, like in the work that I do, absolutely can speak with clients in Bengali and do case management work with them, but I can't read and write in Bengali with the fluency required for government documents, for example. And that's just like me, one person, and we'll have so many people like that on a variety of spectrums of how much they're able to actually do. And that's very different from a professional interpreter. So just keeping that in mind.
Thank you. I see that someone has their hand raised. I just want to encourage folks to put their questions in the Q&A box, and we will absolutely have enough time at the end of the presentation today to address all of those questions, or most of those questions. I'm not sure how many there are. Next slide, please. So going back to, and just wrapping up for best practices and recommendations, whenever possible, advocates that speak the client's preferred language will meet with the client. So this is something, again, basic case management services with bilingual staff, and matching those staff by language is perfectly appropriate. And in fact, I believe builds trust. It builds rapport and that feeling of safety. I would also suggest that when there are clients, just like any circumstance, not only language or country of origin, but that there's potential triggers and boundary issues that can come up when there are any case manager speaking to any survivor that has experienced something similar or comes from a similar place. And so we just want to make sure for the supervisors that are on the line and for those who have supervision to bring those things up. It's absolutely typical and normal and okay to be triggered by client stories, to be reminded of one's own experience when working with a client who may have, again, speak the same language, be from a similar place, or have experienced a similar trauma or even hardship. So again, the goal is not to to not have that match, but instead to be honest within supervision about whatever triggers that might bring up. So on the opposite end of that, we recommend that social service staff do not act as interpreters again, where individual rights depend on precise, complete, and accurate interpretation, such as court. And again, I think that we covered why this is so important. But I'll share a story that we once had. We're petitioning for a protective order, and the survivor had been hit with a bat by her perpetrator. But in her language, there was no exact word for bat. And so the word board was used, and the judge, who is persnickety on his best day, and the defense attorney really focused on this, and we're like, wow, she's changing her story. And so having a professional interpreter there to be able to explain on the record why there was that discrepancy in language made all the difference in the world. And it's something that I think staff who actually has told over and over again that they can't speak up in court as an advocate, it's something that they wouldn't maybe feel either compelled to do or even be allowed to make that clarification. And so it was just such a powerful and real example to me of that need of having a professional interpreter be there when precise language is required.
And I'll just interrupt and add here. There are, I think, so many other implications as well for advocates' presence in court. One example we can think of, and we also kind of discourage our advocates from testifying in court or serving as translators in that way, for the reason of, let's say you're translating for a client and they tell you something that they would not have necessarily said in court, but because they're comfortable with you, they've now said something that's on the record that you now have to translate, which they likely did not intend to do, but because you're serving as translator, this added layer of comfort is now creating a different issue in the case. So that's something else to consider.
Yeah, it can be rough. Thank you. So this is another issue that has come up a lot. We have about 45 employees at the International Institute. We're a small to medium nonprofit, and our staff speaks 13 different languages as of today. And we were kind of getting into the habit of calling, we have a list at the front desk, and reception would call staff that spoke that language, especially we have a very large Burmese population in Buffalo. And so what we've found is that we were really kind of taking advantage of those staff members who were trying to get their own work done. And we were interrupting their day. It was hard for them to say no because we're survivor support services. It must be an emergency. It must be a crisis. And we just made the assumption that they would tell us if they couldn't come down, if they didn't have time. And that wasn't happening. And so I just think that that was a hard lesson learned. I often say that one of the reasons I'm an expert is because I've made every mistake out there, or I continued to at least. And that was definitely a lesson learned about, again, setting boundaries for our own staff and not adding a role of interpretation, which again, you're doing your work as a case manager, and even if you're bilingual, that's using different parts of your brain. And so that can just be exhausting as well. So just being, again, mindful of that. And for management staff to just be thinking through, is there any, to make sure that bilingual employees feel safe and comfortable enough to be able to express their concerns if they're being pulled into interpretation, which is not necessarily in their job description, that's getting in the way of their typical duties. It's just something to, I think, keep in mind. And this is a big one. Minors should not be used as interpreters, except to identify the client's preferred language or perhaps in a medical and an emergency. The reasons are perhaps obvious, but I think it's just so important to remember that especially a survivor, when talking about something important, will often, and of course, not want their children to know the truth about what's happened. We see this a lot, again, in our, when the trafficker, the abuser is the father of that child. Mom is not going to be honest or maybe even complete about the details if it's being said in front of a child or if the child is expected to interpret. And I will say that this is also true even if the child is an adult. I think sometimes that we forget that like, oh, we'll use the child because they're 25 or even 30. But again, that relationship is still there. The other thing that's important to think through around systems is to be thinking about, and we have done a ton of work with the Buffalo Police around this, is how they will use language line, who is not an appropriate interpreter, like a bystander, when they're on scene. We have seen far too many times that the abuser or the trafficker will identify themselves as a community member or as a helpful interpreter, and they will volunteer to interpret for a police officer on scene, and then of course intimidate just by their presence or misinterpretation the survivors from telling the truth about what's happened. We've also found that when somebody accompanies a survivor to a walk-in, or even now we've seen this online, and they, I brought a friend to interpret for me, and we later find out that that friend is a relative of the abuser or the abuser themselves. So at the International Institute, it is our policy, and again, blame the policy, right? But we say that for the first meeting with a new client, we always will use a professional interpreter, language line, or a bilingual staff member alone. And we just say, oh, great, that's really helpful that you brought an interpreter. Our policy here is that at least for the first 15 minutes, we use our own interpreters, and then we'll be happy to invite your friend back. And I would say 9 times out of 10, that person isn't dangerous. But we want to make sure that we've covered all those bases and that we've given the potential survivor, the client, the opportunity to share with us that this person is, in fact, a trusted person in their lives. And then again, we talk to the client about when it might be appropriate to use that friend for interpreting, but to really emphasize that we have the funding, that we have the access to be able to not have to use that friend. And I find that this is especially important because there are other systems that have likely told that person that they have to bring their own interpreter, or we don't have money to pay for an interpreter, or we don't work with people who don't speak English. I'm amazed at how often we still hear that. And so often you may be countering messages and statements that have been given to that individual prior to entering your organization. Which brings me, I had just mentioned budget, so I'll just add one more thing, that at the Institute, we talk a lot about having a culturally responsive and linguistically accessible budget. Now, what does that mean? That means that we ensure that language access and cultural responsiveness is a line item in every budget, in every contract or grant that we apply for, and certainly is a significant part of our annual budget that the board approves. I think that this, if you start to think about and we know language access can be really expensive. And often I think when organizations change from seeing it as an added expense rather than just part of their services, then that shift in lens can really help. I just see this question here. We call it having a culturally responsive budget. That's how we think of it. We also feel kind of wary when we're applying for a grant that doesn't ask us to address cultural responsiveness or language access. So I think that it's important when you're talking, if your organization has a development team, if you have grant writers, or if, like me, you are a supervisor and you just are in charge of all of those things, that becomes part of every budget. And in fact, our finance team will not approve a proposed budget for any contract or grant that we apply for without those line items in them. We'll go to the next slide. So now we're going to ask you again, what Takenia and I have hoped is that we have expanded this, what it means to have a language access plan, that it's not just about individual language accessibility. So given that, I just want to ask again, does your organization utilize and I would add here, comprehensive language access plan? See the results there? So we see that the yes has gone down just a little bit though. And so again, this was not certainly a gotcha poll. This was just about, I think, thinking a little bit more broadly about what a thorough comprehensive language access plan can look like, and also is more effective when it's expanded to include several different components. We'll go to the next. So we wanted to talk through a few scenarios that, again, it's a part of our learning objectives, but also are based on experiences that we've had. And I'll read through them, and then we'll just ask if you could respond to them in the chat box to see if, or the chat function, to see if maybe you've also come across this and to ask how you've handled it. So we'll go to the first one. So you've been providing services to a large group of survivors. So this would be like a multi-victim case in your emergency shelter. And you've been interpreting for many of these clients for several weeks as a bilingual staff person. You also know members of your own community who work as interpreters and are working with other clients involved in the same trafficking case. Over the weekend, one of these interpreters approaches you to talk about the case and says, "Can you believe how awful this case is? I couldn't even sleep last night because I was so sad about this case." So what would be the best way for you to respond to these questions, or what might you think about when you're responding? So again, I'm addressing all of you from Buffalo, New York. So even though we have a fairly robust interpretation and translation department here, as you can imagine, the pool of interpreters, we contract with about 300 interpreters who work as consultants for us and contract workers for us at the Institute. But for some of those folks, the languages, it's a pretty small community. So it's not at all unusual for us to talk to an interpreter and they'll say, "Oh yeah, I already know about this." And it's like the first time that we're asking that we've asked them to interpret. So is there anything in the chat box that's come up?
So I really like this answer from Linda that's saying, don't speak about the specifics of the case, but support the person around the vicarious trauma they are experiencing or help them find someone to talk to. So I really appreciate this answer because absolutely, I think we know because of confidentiality, we cannot necessarily discuss the case with the person, but this is also identifying that the person is coming to you because they're having a hard time with it. You may not necessarily also be the right person to have this conversation with them if you're also processing. And so whether it's you or whether it's finding the right person for them to talk to, I think is a really great way to still be supportive and identify that this is a hard thing, while continuing to maintain and respect confidentiality and boundaries.
Linda certainly gets the gold star there. It's so important. And I would say that that's also a hiccup that we've experienced at the Institute, is not always remembering that the interpreters that we work with are an important part of our team and therefore experience vicarious trauma just as we do. They may not, I think it's better now, but when we started doing anti-trafficking work, I would say that most interpreters, just like the general public, couldn't believe that human trafficking was happening in Buffalo. And so the overwhelm of that realization, as well as hearing the specifics of the exploitation, and also knowing that some of the traffickers were from their own cultural community, even if they didn't know them personally, was a lot to take on. And so when we are training interpreters now we have a training program at the Institute for Professional Interpretation, we do address vicarious trauma. So Linda, thank you again for bringing that up. We'll go to the next scenario. So while you're interpreting for a survivor of human trafficking who lives at a local apartment complex, his landlord calls and demands to know where his rent money is and why it's late. You learn that the survivor only received payment notices in English, a language that he cannot read. After the survivor tells the landlord that he cannot read English, the landlord tells him that he won't do anything to help him. So what do you do? And I'll wait to give folks some time to answer here. I'll also say that we laugh, but it's not very funny, but that we found a couple years ago that our local Department of Education would simply send notices home in Spanish for any of our clients that didn't speak English, even if they spoke Burmese or Swahili. They would just get something in Spanish, which again, we had a good laugh about, but then had to go back to the Department of Education and talk a little bit about why that was not effective. Chat here, any good ideas here? Tina, is there anything to share from the chat?
Yeah, so I'm seeing some answers that are saying things like, with permission, asking to speak with the landlord themselves and advocate on the survivor's behalf. And yeah, I think sometimes that's, for us, honestly, that's been some of the more effective ways when there is a third party stepping in. Sometimes you'll see the tune start to shift, especially when it comes to these sort of things. I see some of these are a little more specific to the state or city that people are speaking from. One answer, for example, was saying that their state has a division of human rights and fair housing that would have options and resources. Another similarly was a reference to the Northwest Justice Project, to have an advocate work with them for the discrimination that they're experiencing. So yeah, those are kind of the two biggest answers we're seeing.
Thank you. I think I will say that it has not been uncommon for either a landlord or frankly other shelter programs, other systems to say that they don't work with people who don't speak English. And my first thought is like, shh, can't say that. Don't say that out loud, right? Someone would never say, oh, we don't work with people who, are blind or whatever, right? Like it just wouldn't, they would at least know that they shouldn't be saying those things out loud. And yet discrimination based on language or culture seems acceptable to some folks. So what I want to say back immediately is that that's against the law, that's discrimination, which is probably not the best immediate response. But I think that what can be helpful, and in this scenario, is that the way that the landlord is communicating is not effective in him getting what he wants, which is his rent money, right? So I think that having a conversation around what's effective can be really helpful. And then I know there were some specifics there, but what I'd like to suggest is that most communities have some kind of fair housing access organization or a homeless coalition of providers that may already, or you may suggest that they offer a training for landlords on effectively working with individuals whose English is not their primary or first language. Because I know that through our partnership with that housing rights organization, we've actually been able to recruit a lot of more landlords that are eager to rent to our clients. So it really has been a win-win. Next scenario, please. You've been interpreting for a survivor of trafficking at family court. The client's assigned attorney for her custody and protective order asks you to interpret for her in a conference room after court has ended, and you agree. After the meeting is ended, the attorney approaches you and asks for your personal cell phone number and email address so she can contact you to interpret for another meeting she has at her office later that month with the client. How would you respond? I'm going to say that this has happened to us over and over and over and over again. I'll give folks a chance to respond in the chat.
I'd also like to point out that the assigned attorney shouldn't have asked the person to interpret in the first place. To begin with, they should have had a professional interpreter.
I also would say that this happens with our professional interpreters. Both are true. And especially when the cases are involve a lot of abuse or exploitation, interpreters have felt willing or even compelled to share that information. So again, that's part of our training for interpreters, is to talk about how important that boundary is and how we can support the interpreter in those types of situations. Sorry, I don't mean to read for you, but I love, no, the lawyer's trying to get a free service. Yeah, I think, again, it's important to acknowledge that language access is costly and takes more time. I would also argue that in the long run, those things are not true. That when you are using appropriate and or professional interpretation from the beginning, then you are going to get the correct information more quickly and not have to go back and get another interpreter or start a petition or a case or any service all over again, wasting the time that happened in the beginning. So that's often an argument that we've used with attorneys. Also that entire cases can be thrown out if a professional interpreter is not utilized. And that's definitely something that our DA here in Erie County is very concerned about and reminds us all of regularly.
And based on the policies as well, it's also very much the responsibility of an agency providing legal services to ensure they have adequate language access, right? And so I think sometimes what ends up happening is perhaps it feels like a hassle or whatever it is, or I think like the point Amy's making is if you already have the proper services in place, it gets that much easier. I think for some places the barrier is that getting started point. And then because there isn't anything that's been established, then nobody wants to go down that route either. And then these other avenues are explored.
Yeah, it's a great point. We actually make sure that all of our advocates and case managers, as well as the professional interpreters that are employed through the Institute, bring with them those iSpeed cards, and then also have printed out the process that attorneys can go through in order to access professional interpretation. It's also something that we do at the beginning of working with a client and their assigned attorney. We make sure we email that process to them so that it is documented that that process has been shared with them. Because there have been times where, attorneys are like, oh, I didn't know, or you never told me, when we know that we did. So that's part of our internal process as well, that saves time. I also wanted to make one other point. Again, thank you for the reminder in the chat about client choice. And seeking information, both. Again, there are some languages and dialects that are so unique or unusual that everybody knows everybody in that community. And so it's important to be able to speak with the client about their preference in what type of interpretation they want. And also that there's a protocol about the client indicating to you that they know the interpreter and don't feel comfortable. If it is a professional in-person interpreter, the client might already know. We've actually had that scenario where we've showed up for court and the interpreter is the abuser's family member, like the paid professional interpreter is a family member of the abuser. And so we want to make sure that we have talked to our clients prior to having an in-person interpreter so that we have a protocol where they can indicate that this person isn't safe. And then the other thing to talk with them through around choice is, do they want the same interpreter? So we encourage survivors that we work with, we ask them, how was that experience for you with this interpreter? Would you like to work with them again? So that we can espouse choice as one of those trauma-informed principles as much as possible. And then in what format? Some survivors we've found feel way too uncomfortable to talk about the abuse or exploitation they've experienced in front of a live person. And so a phone interpreter feels a lot safer to them. And in the reverse, we've had some survivors say like they don't trust anyone they can't see. And so they will only work with video or in-person interpreters. So that information seeking and espousing client choice is so very important in every aspect of quality case management, including language access. And next slide. Oh, there you are.
All right. Well, Amy and Takina, thank you so much for the information that you've shared. I know that for me, it kind of just triggered a lot of questions as we've been doing the policy and procedure reviews for a lot of the OBC grantees. We've been asking, about language access plans and having formally one in place. And so, so I think these are like really great things to just keep in mind regarding what should be in there for them. So thank you so much. We have had some
Diana, can I interrupt? There's been so many great resources that have been linked in the chat. I just want to make sure that the follow-up will include all of those resources.
Absolutely. We're keeping a list of everything that has been shared because, yeah, one of the questions that came in was about the I Speak cards. And so I know somebody was able to find them and quickly get them for us. So, so all of those materials will be shared out within 2 weeks, just so we're able to compile it. But we did have questions. And again, thank you all for just participating in the chat box. It's been great to read everyone's answers, everyone's, suggestions, and even corrections. So that's really, really helpful for us. We are learning together. We're, hopefully creating this space so that we can all collaborate with one another. And as Amy mentioned, I think we all learn from our mistakes, and that's kind of how, Amy, you've shared that a lot of the experts come, from just learning things. And so I think that's great. So with some questions that have come in through the Q&A box today, and I want you to just, if you wouldn't mind, Amy, repeating that again, because I think it was really interesting, the question that we received regarding the better way of saying limited English proficiency that doesn't center white supremacy. And so I think you mentioned 2 specific words, and I just want to have those so everyone can hear if you didn't join us when you shared that.
Yeah, I'd also ask others if they have examples, but the examples that I've heard and that we utilize are new English learners or new English speakers.
Thank you so much. And yeah, if you have any other suggestions that you've encountered or anything, feel free to drop that in the chat box. The next question is, with the added challenges related to social distancing with COVID, curious on thoughts, pros and cons related to needing to utilize technology to access interpretive services. So maybe if you wouldn't mind discussing what your experience has been through this time, and as you mentioned earlier, Amy, just kind of giving that choice, but with the limited, restrictions now, how has that worked for y'all?
On our end, I would say because we don't get too many requests for in-person interpretation, it has pretty much stayed the same. In the beginning of the pandemic, though, it was getting a little bit difficult because not only was the interpreter on the phone, but the advocate and the client, everybody was on the phone together because we weren't having in-person services for the first several months of the pandemic. So I think it's one thing when the advocate and the survivor are sitting with each other at least, and then it's just the interpreter on the line. But when it was all 3 people on the line, it was taking even longer to get the message across and make sure everyone was understanding each other. So that was a little bit tough. At this point, we've come to a place where our residential survivors at least are getting in-person services, except for the translation piece and so an interpretation piece. So we're kind of back to now just working with the interpreter on the phone.
Yeah, I think so. We've seen, I've mentioned throughout that we have a language access department at the Institute, and my department is one of their customers. So there's a link to our website if anybody's interested in that. But one of the things that I think is really helpful is that we train interpreters on human trafficking and domestic violence and sexual assault. And that's one of the things that they're coded for. So again, we have over 300 interpreters, and then whatever training they go through, whether that's legal interpretation, medical interpretation, education interpretation, or survivor support, they are coded for that in our system. And then we'll, when we put out a job request, only those that are coded we also do trauma-informed care as part of that training, will see those available jobs. So I just wanted to throw that out there. But since with social distancing, in general, we very much encourage in-person interpretation for, this is within our own services, when we are drafting protective orders. So our advocates do that in-house. And when we have clients that are high risk. So those that are at the highest risk for lethality, we try, especially around safety planning, to have in-person interpreters. During COVID, that switched to video interpreting. So we had our video interpreting requests skyrocketed during that time. And we actually have worked fairly effectively within our hospital systems, encouraging them to utilize video interpreting during COVID as well. It was actually kind of neat. This is a little bit of an aside, but in Erie County, at least, our hospitals were one of the first systems to receive access to vaccinations, and the interpreters who were coded for medical interpretation were invited to take part in those vaccinations because the hospitals really considered them part of their team, even though they didn't, weren't employees of the hospital. So we saw that as a really big success in the training that we had done with the medical facilities in our area.
Thank you so much. And then there's another question here regarding, is there a way to advocate for reduced fees for services that charge by the hour for clients who need interpretation? For example, for a client who needs an interpreter during a meeting with her attorney who charges by the hour. So if you have any ideas of like advocacy to, decrease those services if possible.
For us, we've noticed, especially if like your organization is working with a person or working with several people who might need interpretation services, if you're able to go into a contract or an understanding with this agency that you would be using their translation services more frequently, more often than not, you will get a reduced rate for that reason, right? And so if you kind of have a point of contact in the agency doing the interpretation services, that's a great way to start.
One of the services that we provide at the Institute is to help organizations create and implement language access plans. And we're the experts on doing that. So I would also just ask them, what are your suggestions in using language services more effectively? So our Department of Social Services schedules, they have like language days. So they will hire a Kirawandan interpreter on the first Tuesday of every month, and then try to, as best they can, schedule all of the individuals who speak Kirawandan for appointments on that day. So that's something they had just never thought of, and something that we were able to help with. We also have constant emails within our agency to say, I booked this interpreter, I have them for 2 hours, I'm done early, does anyone need to make some phone calls? And so just having communication or bringing in other systems. If we know we've booked that interpreter for 2 hours, but we haven't utilized them for that whole time, we'll call their housing case manager, or we'll call their shelter provider to say, this person is available for another hour. Is there anything that you'd like to talk with them about?
Thank you very much. And then another question that came in is how an interpreter can be trained by the Freedom Network in those specific areas. While we do housing and Freedom Network, I should say, and some advocacy work, we don't train interpreters themselves. And so, like, Amy, maybe you have some resources for people that would want to get trained in those specific areas that you were mentioning.
I wish I did, other than to say, like, we created our training and we do train our interpreters. And so certainly that'd be something that we'd be willing to open up. I think we do our training twice a year. And so it'd be something I think that we could certainly talk about if there was interest to open that up. I will say that in general, interpreters pay for their own coding and their own training. And so that's the way that we work, because obviously it benefits them. They can then work more often if they're coded in several different systems. So if there's interest, my information is in the chat, and I'd be happy to speak about that opportunity.
Thank you. And yeah, there's all sorts of resources in the chat. We are saving it. We are going to be sharing that with everybody. And so just be on the lookout for the email that you'll receive within 2 weeks. Now, we had a lot of questions regarding resources as far as, being able to assist clients who speak different languages and templates for language access plan, resources for locating trauma-informed interpreters. And so I think, if you want to kind of address that in the broad sense of how one goes about, finding resources or doing that in their specific community.
So I would read through these links. The one I'll say that I've learned the most from, and it's here, the API resource, and there's actually an entire link for a language access plan hub that has a ton of resources. So this is API, help me, Center for Gender-Based Violence. Is that the name of it? Yes. So they've done, I think they're actually have been the leader in this field, specifically in the gender-based violence realm, and not only for the API community, but really best practices across the board. So that's where I would start. That's where I have gone again and again. I've co-presented with them. They have a lot of fantastic resources, although I'm not familiar with everything that's in the chat. So certainly there's a lot to look into there, especially if it's something state specific to where you work. And I'll just say one more thing on that. I think that having your upper levels of management invested in an effective language access plan is really important, because that's who controls your budget, right? So I think tracking, like one of the things we did, gosh, it's been like 7 years ago now, but one of the things that we did is we tracked for 3 months how long it took us to work, like to get from point A to point B, which was our just general orientation of services, safety planning, signing of all of our forms, just that like general introduction and needs assessment services. So we tracked that for 3 months, about how long it took for our non-English speaking clients and how long it took for our English speaking clients. And we found that it took 7 times as long to effectively work with those non-English speaking clients as it did with our English speaking clients. Again, not just in the time that it took for interpreters to speak, but also in the amount of time it takes to explain those cultural nuances. Or I remember once just having a whole session on the fact that women could be judges in the United States, because we went into court and this client was like, didn't understand what was happening because there was a woman on the bench. And so those types of things. And that statistic was transformational when it came to our upper management and our board thinking through our budget, and also gave us a lot of, gave us data when we were advocating for lower caseloads through our grants. And so we had, some grants where we were expected to serve just as many clients as organizations that were only working with English speaking clients. And so gathering that data helped us to advocate for more reasonable caseloads and budgets, right? To say that if we're going to be doing this work, then we need a substantial language access budget. And therefore our ceiling on that budget should be higher than organizations that are working almost exclusively with English speaking clients.
Absolutely. And so we have time for a couple more questions if folks have some. But one of the ones that came in through registration was, how do you best serve a large community with many different language or communication needs? And I know that you both have a lot of different language needs, so maybe kind of addressing that a little bit, if you wouldn't mind.
So I think one of the ways we've done that a lot, which we've kind of said not to do here, is we've heavily relied on our staffing body. Our staff themselves are kind of coming from many, many diverse places and reflective of the populations that we serve. And so this is helpful not only for language access, but even for understanding cultural gaps and barriers that one might not usually understand. I would though say it can become exhausting for staff, like the example Amy had previously brought up, where staff who are speaking other languages end up getting pretty heavily relied on sometimes for calls and translation and things like that. So that's a good way, but I would also be mindful of how often that's used.
Yeah, I think, like I said, that we are not a culturally specific organization. We serve our niche in the domestic violence, and or our specialization is around non-US citizen survivors of crime. And so inevitably, I would say 99% of the time, the case manager or advocate is not from the same community nor speaks the same language as the client. And so one of the things we really encourage is to not worry too much about mistakes, to recognize the power dynamic that happens there, and to try to even that out even a little bit. So we will often ask the client, how do you pronounce your name? And then ask the client to try to pronounce our names. And inevitably, we just start laughing at ourselves and each other and talking about, we try to have some basic words in that language that they speak. And then we practice that with the client so the client can teach us a little bit. So again, just really thinking about that power dynamic, I think is really important and helpful, again, to building rapport. And to, I think the other, again, I'm not talking about budget here, I'm talking more about trauma-informed care. But the other piece, I think, is to, when we have language access immediately available, it is seen more as simply part of our services than an added cost. Many survivors, no matter where they're from, feel like they're, a burden, or they don't want to ask too much. And we find this to be especially true in the foreign-born population, that they, and again, not every community or not every survivor feels this way, but many do feel like they, it's a burden, or they don't want to ask for too much. And so by providing it from day one, it's just seen as part of their service, and hopefully takes a little bit out of that helping dynamic that inevitably forms in the service systems.
We just had I believe our last question here. How often do you reassess the most common languages in the community you serve?
Quarterly is my answer. That's what we run all of our data, both internally in our department and then in all of our departments quarterly, so that we are not missing anything. Frankly, it's really self-serving, so that we are, for example, and we have a refugee resettlement program. And so we recently, I guess before the Trump administration, and now again, we're seeing a lot of Congolese clients. And that's something that we found through our data, and immediately we're trying to connect with organizations both locally and nationally who would be able to support us in our learning curve around some, of course, general, but maybe specific needs or tendencies of that specific population when it comes to victimization. And that's something that once we have learned more, we're able to help those organizations that we make referrals to interact more effectively with those populations.
We're also assessing kind of same time periods. where we examine the calls that come into our hotline and are noting what are the language requests, what are the case assignment requests that are coming in, and we'll use that information to also pay attention to our hiring of advocates. Do we need to hire more advocates for a specific language? Do we not? We also pay attention to city and state reports that come out. So recently there is a study that came out in New York City that was showing us immigration trends. And so we are also using that information of like, who are new immigrants into our city, which countries are having kind of highest rates, what do we need to pay attention to in terms of our hiring and in terms of like training and material that we produce.
Thank you so much both for sharing your experiences and your expertise with us today. Thank you everybody for joining us. It is now 4:30 Eastern time, so we'll end it here, but feel free to chat with us, look at our resource library. This will be uploaded shortly, and then the email will be sent out with all of the materials for today. Once again, thank you, Amy, Sakina, and we will be dropping your email addresses in the chat box so people can contact you if that's okay. Feel free to also reach out to us at Freedom Network USA, but we'll end it here for today. Thank you, everybody.
Thank you all. Have a good one.